Welcome to the Stevenson University Library Nursing tutorial on understanding sources. The previous tutorial discussed finding information, but that's just the beginning of the research process. As a nurse, the next step will be to understand the information sources you've found. By the end of this tutorial, you'll be able to define scholarly research, clinical information, and patient education information, and examine your sources of information. To understand the articles and information you've found, ask yourself the following questions. What type of information is it? Is it peer-reviewed? Is it primary or secondary? Is it quantitative or qualitative? Does the article provide information for evidence-based practice? Is the information reputable and accurate? How does the information in the article relate to the research question? Three common types of information are scholarly research, clinical information, and patient education information. Scholarly research is a broad category. Here are some different characteristics of scholarly articles that you might see. The information must be accurate and authoritative. As you can imagine, this is one of our top criteria for information that impacts patient care. Peer review is the process by which academic research is evaluated by experts in that particular field before publication. It maintains accuracy and quality in scholarly work and provides a standard for evaluating research findings. Peer-reviewed articles add credibility to your arguments, help to build your knowledge base in a particular field, and serve as your source for the best of original research in a field. Some databases allow you to limit to peer-reviewed sources by selecting scholarly or peer-reviewed as a limiter. Scholarly research is often separated into two categories, primary or secondary. Primary sources are also called original research. They are usually studies, trials, or experiments performed by the authors who wrote the article. Primary sources are how we find out about new developments and practices in nursing. Primary sources are published in scholarly journals specific to the field. Secondary sources are also called reviews. They synthesize information found in other sources, including primary sources. Secondary sources contain interpretations and evaluations of other sources. Secondary sources are also published in scholarly nursing journals. They can also be included in evidence-based practice tools or in articles from trade journals like Nursing Outlook, which are geared toward working nurses. Two other types of research articles are quantitative and qualitative. Quantitative research, also called empirical research, generally refers to research that tests hypotheses to measure the relationship between two or more variables. The focus is often on numbers or statistics. An example of a quantitative research question is, what is the effect of crossing legs on blood pressure? A study like this might measure blood pressure both before and after a person crosses their legs. The first variable is leg position, crossed versus uncrossed, and the second variable is blood pressure. The researchers would statistically analyze the data to determine if a causal or correlational relationship exists between blood pressure and leg crossing. Qualitative research generally refers to research that uses interviews and observation to explore a phenomenon within a real-world context. The focus is often on the participants' perceptions, experiences, or feelings. An example of a qualitative research question is, what is the experience of hope in women with advanced ovarian cancer? A study like this might include interviews of women with advanced ovarian cancer. The phenomenon in question is the experience of hope. The researchers would develop a set of questions that they ask each participant and use their responses to understand the patient's perceptions of whether their hopefulness impacted their health. Scholarly research contributes to evidence-based practice. Evidence-based practice, or EBP, is the process of using objective scientific research and expert opinion to help us decide how we should care for patients. Evidence-based practice is also referred to as evidence-based medicine, or EBM. Evidence takes two main forms. Primary evidence, also called unfiltered literature, draws on original research findings gathered from research subjects or participants. Secondary evidence, also called filtered literature, draws on a range of sources pertaining to the topic being investigated. EBP literature can be found using library resources such as CINAHL and Medline. Government websites like AHRQ's, National Guideline Clearinghouse, and PubMed are also good sources of EBP material. So far, we've focused on scholarly articles because you're often required to use those in your nursing projects. However, there are two other types of information. Clinical information will most likely be utilized when you are presented with developing real patient treatment plans. This type of information is typically secondary information, meaning that it has already been proven effective by previous research. In the Stevenson Library databases, Nursing and Allied Health Reference Source includes clinical information. You can also find this kind of information in professional journals, such as Nursing Outlook, which are intended to keep working nurses up to date on information pertaining to the profession. You can also search for clinical information using databases that are specifically geared toward evidence-based literature, such as CINAHL and Medline. Patient education information is different from the information that you would utilize as a professional. Your patients will most likely not have the medical background and training that you have as a nurse, so scholarly articles and clinical information may not be appropriate for them. Instead, give them sources of information that are clear, concise, and written for the general public without excessive medical terminology or jargon. In the Stevenson Library databases, Medline and PubMed contain patient education information. Look for the patient education handout article type. You can also refer patients to government websites. They are written specifically for the use of the public and therefore will be easier for patients to navigate and comprehend. In addition, websites about health and medicine may be helpful for patients. Many well-known medical institutions, such as the Mayo Clinic and Johns Hopkins Medicine, make patient education information freely available online. Just remember to carefully evaluate any information that you find before recommending it to a patient. Congratulations! You are now able to define scholarly research, clinical information, and patient education information, and examine your sources of information. Thank you for watching. Contact the library if you'd like assistance. If you'd like to share feedback on this tutorial, you can do so at the link or QR code on your screen.